but anyway, so this is kind of where I was with the voice of the community, and this is the, change in our population and what it looks like. So, aging science. This is something that I've become interested in. I was just talking to Dr. Jane about the fact that, turning 50 makes you start thinking about, oh my God, like aging. So I'm going to try to, slow that down. How do I do that? And so there's a lot of people out there on on podcasts and everything. These are some of those big voices. Someone that I really pay attention to is Eric Topol. He was my, when I did my rotation in cardiology, he was the cardiologist on. And so I learned so much from him, and I always sort of followed his career and what he's doing. He's doing some amazing stuff, and he's also talking about aging science, but he's doing it in a more evidence-based way. And one of the key, things that drives aging, and everyone sort of talks about this, is inflammation. And so inflammation, as you can, it drives heart disease, atherosclerosis, damage to the arteries that cause these changes is caused by inflammation. Cancer, I mean, our immune system is going to be recognizing and regulating cancers and preventing their spread. And some of that is, when that inflammation is sort of out of control or dysregulated, that can also happen. Neurodegenerative impact of inflammation on our brain, and I'll show a slide on that, has a real impact on aging as well. And then, of course, autoimmune disease is a big part of that. And so slowing down aging and its related complications means that we need to target inflammation. And something that researchers are still on. I'm always glad that, when we're seeing on the pipeline that there's drugs, targeting inflammation, that's always, a really great thing. So, it's a key, as I mentioned, a key role in preventing, in driving disease. Inflammation is a term that's being used sort of more in the lay literature. But in looking at inflammation, aging, there's something that we don't really discuss, but with asthma and COPD, when they're not well controlled, they lead to accelerated aging as well. I mean, people with asthma will die 4 years younger, or COPD up to 10 years younger if we don't control, we don't treat it, we don't do something about that inflammation. There's other, just pro-inflammatory mediators will, play a role in disease progression as well. So there's a role in cell death and, other things that can happen. And so, and cancer rates are, as we can tell, are in like the highest rates are in those areas where there's a lot of inflammation. That's why the GI, and we're going to hear from Dr. Friedman later on talk about this, but that's why the GI tract is so, so prevalent as far as the cancer risk. It's also respiratory and reproductive as well. And one thing that, that other shoe dropping, this is a abstract at the at the NACFC last year, Arya and Dr. Stevenson from Toronto. They essentially, and I'm, looking at, comorbidities that present in CF, and it's always 20 years earlier. There's always, this is, and I'm saying this, for people in the CF community, not to stress you out more. Stress also causes inflammation, but like that, we're going to be doing something about this. We got to recognize this. This is the studies that are important so that we are going to do things to slow this down. Right now, one of those things that Megan can talk about, inequity, the people who are doing all this stuff or benefiting from aging are the people who are really wealthy, because they have access to all this information and the type of care that can really dive into the inflammation and things like that are driving it, the personalized medicine approach. So we want to make sure we make this accessible for everybody. So cardiovascular disease, malignancy, 20 years earlier and much earlier for those who've been transplanted. The Framingham, heart study is a study in Framingham, Massachusetts, where they studied 5,000 people starting in 1948. Really like an amazing thing that they did, looking at comorbidities that would cause cardiovascular disease. And we always talk about it. And when you even look this up, age, high, blood pressure, cholesterol, weight, all these things are, what we read about. But one thing that is really important is that, especially for women, vital capacity, or how much air you can blow out, like your activity level. So really, Nicole's talk is really tied into this, because exercise, lung function, and just your aerobic capacity, any bit of exercise you're going to do is what's going to have actually the greatest impact. And if the aging experts agree about one thing, it's that exercise is the most important thing that you can do to slow down the aging process. But this is something that we don't really talk about that much, but your vital capacity has a significant impact on your cardiovascular mortality. So we got to do something about it. And just very briefly, showing data from, the recent, vanzacaftor, tezacaftor, deuterated ivacaftor study, because we've done such a great job with Trikafta, and we showed that this drug is, equal to as far as lung function. But, why are we doing this, and why are there more studies actually looking at small molecule therapies that are improving CFTR function? And it's because maybe the CFTR function improving and becoming closer and closer to normal is going to have an impact on some of these aging comorbidities and things that are going on in the future, in your future. And so there's a study that just came out looking at ivacaftor in this group of age less than 1 to less than 4 month old, and showing that there's a decrease in immunoreactive trypsinogen, which is the inflammatory byproduct of pancreatic inflammation, or fecal calprotectin, which is a signal for GI inflammation. There is, other studies have, continually shown, whether it's in sputum or blood markers, these are chemicals in our body, these things called IL-8, IL-1B, IL-6. These are things called cytokines and chemokines that essentially are markers of inflammation because they recruit cells to constantly cause inflammation in our body. So, sputum, blood came down when lumacaftor, ivacaftor, and tezacaftor, ivacaftor came by. They also, showed significant improvement in this. And then also now we're seeing with the triple combination ETI that there are significant improvements in other markers as well, and looking at CXCL1, granulocyte macrophage colony stimulating factor, IL-8, IL-16, I'm sorry, 6, as these are things that are improving. So improving CFTR function, improving through these small molecule therapies does reduce inflammation. So Eric Topol, and he's written a book. He's you guys can listen to him. I really love listening to him. But he talks about these sort of 5 themes, and lifestyle is one of the biggest ones. So making sure you listen to Nicole and you do your exercise and you get out there. I don't care if it's 10 minutes, 20 minutes, an hour. You don't have to run marathons. It is just important you do that. But it's also important, as you can see there, your diet is like a significant contributor. A healthy diet, and a study that is looking at large populations, like up to 165,000 people, shows that your diet has a significant impact on that. And I'll talk about what a healthy diet is, but we also need our dietitian colleagues to do that. And then also social connectedness. I mean, we talk about this all the time in its role in dementia, neuroinflammation, how that social connectedness really makes a difference. It reduces your stress, reduces all those things that are gonna, cause you to, prematurely age. There's genes and proteins. I mean, we are doing gene therapy, and Dr. Paluski is going to be talking to us about that. Cells and immunity. I mean, that is really core, and how our immune system works, or inflammation, because there's still some gradual smoldering inflammation that's there. Medicines and vaccines. I mean, not just the ones we know about, but we're developing vaccines to cancer. These are really important technologies. And then artificial intelligence. We already know that there's a study on looking at skin cancers, that AI does better than doctors. Doctors using AI versus AI still does better than doctors. So it is that this is going to be something that is out there. There are going to be ways that we're going to be able to track our data in ways that hopefully will make things more accessible to us. But we won't talk much about artificial intelligence going forward, but it is definitely going to be a part of ways that we're going to target inflammation, believe it or not. These are just the types of foods. I don't mean to bum people out. There's the ultra processed foods. They affect all these things. And the gut microbiome, it just affects everything. It affects heart disease and cancer. So what you eat really does make a difference. And even when you make changes now, it's going to make a difference. But all of these things, refined sugars, the fried foods, that's the advanced glycation end products, come from frying foods or drilling them until their things are burned. Food additives, artificial sweeteners. I mean, things that that are sort of intuitive, are things that are not great for you. And then the non-ultra processed stuff, red meat, just in in excessive quantities. So if you eat a little bit of red meat, it's okay. But alcohol, chronic alcohol use, dairy and gluten only for those with the sensitivities. That's not for everybody, but those can also cause inflammation in our body. And then we heard from Katrine Whiteson yesterday about fiber and creating butyrate. I was just thinking about butyrate when she was talking about that, and how doing a butyrate enema, if you hate fiber, maybe that's what you do. But like, these are foods that are going to make those bacteria, the microbiome, happy, and they're going to help you out and eating your vegetables. So all the things that you guys already know. But lifestyle, so going back to it, I mean, this is just looking at exercise and how these interventions help you in your aerobic capacity. VO2 max is just a marker of how efficiently you use oxygen, and the higher it is, the better it is. And so you can see that, if we are working on this and these interventions that Nicole is, talking about, we're going to make sure that your VO2 max is great. And just like a little plug into we sponsored 10 people with cystic fibrosis to run the Boston Marathon. And so we have a documentary film that is going to hopefully do one more premiere, and then we're going to hopefully release to everybody. But this is one way that you can inspire, people, one, by running it, and those watching them and saying, hey, I'm going to run a mile today. And then they run 2 and 3 and 5, and then they're running 10Ks or whatever they want. Like, but once again, don't have to run a marathon. 5Ks is enough. 3K is great. So anything you can do. So this, I'm not going to spend too much time on. I just want to tell you that there is this, a lot of different ways that, we're looking at how aging accelerates in CF. And I'm just going to focus on 3 of them. And that is, for some reason, not coming up, but epigenetic alterations, mitochondrial dysfunction, and loss of proteostasis, because we think that modulators are actually helping those. So there is some benefit that we're seeing. Methylation, epigenetic alterations are things that that are not in the DNA but affect DNA and how they they translate, how they make proteins and do other things. And so if that can be manipulated in a positive way, that's a good thing. Mitochondrial dysfunction, this happens with like different stressors on the body. We just had a patient that really displayed just how aging and just wear and tear of years has led to mitochondrial dysfunction that may be reasons why they can't, tolerate certain drugs. We're not talking about this, but polypharmacy and all the medications and how they interact is also something really important for people who are growing older, and not necessarily impacting aging or per se, but really important to not causing any problems. And then loss of proteostasis. When we talk about that protein that's folding, that gets misfolded and doesn't get to the cell surface. That misfolded protein sits in the cell, and sometimes that causes stress and inflammation to that cell. And the cell can also, die early that way. It's called cell senescence. So anyway, this is now just the way we want to highlight those, because we think that modulators currently are impacting those. We don't have as much data on anything else. And then I just wanted to add this telomere attrition, something that I talk about, a decent amount with just at parties and stuff, because people love to hear about it. It's really nerdy, but it is something that is associated with aging. So telomeres are these little strands that are the end of your DNA. They, some people describe it as like that little plastic thing on your shoelace that allows you to not to have a frayed shoelaces that like you can't manipulate. But they are there to protect us. And the longer they are, the more healthy they allow the chromosomes and the way our body helps to, make more cells and replicate or duplicate is it helps it do it in an efficient way. And so the shorter they get, the less efficient that is, and more problems that happen, like cancer, mutations, things that will come up from there. So the things that affect it are genetically and non-genetic factors are the ones that, because there's maybe some CF role, but non-genetics are your environment, life events, behavior, all these things that, that cause stress and inflammation are really driving that. And this on the top left shows how chronic stress, in that cascade leads to inflammation. And all of that sort of points to a shortened dysfunctional telomere. There's an asthma study that showed that kids on inhaled steroids, that also impacts their telomeres. And now we have, and it just shows that because that's active inflammation that's happening. And thankfully now we have biologic agents and other things that help really treat those diseases, in a better way. There are this mitochondrial human telomerase enzyme retro whatever. Sorry, I'm not going to remember the name. Oh, here it is, reverse transcriptase. Thank God. That helps restore that. And there's some people who will try to sell you products that may do that, but those really are not, up to speed right now. Definitely don't go to the internet and try to do it. It's just one, they cost a lot of money. and hardly any of those things are going to work. I mean, right now, the best thing for you to do is exercise and be active, and all of this will hope and then reduce your inflammation. I will just tell a quick story about a study that was done on residents and who are coming in. When they first were evaluated coming in, all the residents, the things that made them have shorter telomeres than their peers. There's about 200 residents from 55 medical schools. Family history of depression or family dynamics and neuroticism like had predicted they'd have a shorter telomere. So they came in with a lot of stress from family and other issues. But then we throw them into a stressful situation. And as you can see here, that on average, we lose about maybe 40, 50 telomere lengths a year, and maybe less than that. And, the longer you're working, I mean, I guess this really is for anybody in any, work, 44 hours, 46, 61, 74 starts going up. But in that first year of internship, we have all lost, for all the physicians here, it's already too late. It's like we've lost about 800 of those nucleotides. And so we accelerated aging at that point. Now, a study on CF and telomere shortening is also out there, looking at 168 patients, of which 85, they were able to go back and from blood work and look at telomere length. And it showed here, and I won't go through many of the details, but essentially that men were at higher risk and your lung function also correlated with. So the sicker you were, and being a man was just a little bit higher risk than females who also were sick. They also had declines in their telomeres. But this inflammation, the stress, the reducing that, reducing exacerbations, improving lung function, also helps. And everything we're doing is really towards that. And there is some data that shows that certain mutations, and F5 being one of them, perhaps as a predictor, is also associated with shorter telomeres. And then just finally on telomeres, this is a study from 2013 and showing that vitamin D levels, the higher it is, the longer your telomere length is. So, and this is for everybody. So I just got mine checked and it was 19. I was so disappointed. So, and in another study, right now, this is the one, I just didn't pull any of the data because I had to pay money for it and didn't have access to an article. But because it just came out, over 1,000 participants at age 65, and it showed that taking vitamin D, 2,000 international units a day will help preserve your telomere length. So, I mean, you really need to just be, and we all need to be on vitamin D supplementation, especially depending on where you live. So what are our main goals? We want the expertise. That's why the Pat Nash program we'll talk about is that we're trying to improve that expertise of people out there to make sure that we are addressing people who are aging. And we always want to stay one step ahead. And as Francis Collin put it, we have within our grasp ability to alleviate suffering and improve the quality of life, but not just adding years, but adding meaning to those years. And I think that we all hear that. We don't want to just turn 100 if we haven't been able to move for the last 20 years while being 100. We want to make sure that we're healthy. So the CF Foundation is, addressing that by changing the way that teams are operating. We won't go through this, but it's essentially just the, way the team is shaping really does, sort of addressing that. And we just need to make sure that our core team has, is present. And that we're, making sure that we're monitoring these things because like your team is really the provider, has to be made up of your dietitian, your physical therapist, your respiratory therapist, because no one person can really be monitoring all of this. And there's now so many things to monitor. And Greg is going to talk to us about some metabolic changes. I'm going to mention some stuff here. Hopefully it's going to be accurate because I trust him more. That's what we need the team to do that. And so this is essentially just showing that, and I'm gonna just, it's gonna, just show the different parts of the body, the sinuses, the pancreas, the GI tract, reproductive system. All of these, organ systems are, impacted by CF. And so, or the drugs that we use to treat CF. And so it's really, trying to look at the whole body. And as we're doing that holistically, CJ Bathgate and Anna Georgiopoulos, wrote this article in 2022 looking at mental health in CF. And we know that CFTR is expressed in the brain, and that is expressed in areas of the brain that another study I'm going to show you, can really show that how aging and inflammation can be detected. It is involved in circadian rhythm. We know that the burden of disease causes mental health issues. We know that Trikafta, as you know, like in Europe, the European Medical Agency does have a descriptor saying that may cause depression and anxiety with their triple combination drug. We don't have that here, but we know we see that the brain fog and depression, insomnia, we're seeing associated with Trikafta. Now, we talked to Frank Van Goor, and we know that these modulators don't cross the blood-brain barrier, but maybe there's other things that are doing it. One of these conferences, I learned that the gut secretes more serotonin than your brain. Like 85% of those molecules are secreted by your gut. So maybe the gut microbiome and impact of those molecules is playing a role. And retrial, a study by CJ Bathgate and Anna Georgiopoulos are leading, is studying people who are switching from Trikafta to another modulator and studying the mental health changes. And we know that medical trauma of childhood, it also plays a significant role.